So autoplasty is a way in which we address what some patients really have that bothers them, which is an enlargement of their ear. But more specifically, what it is that it's an ear that is more protruding forward. For these patients, the real solution for this type of problem is where we actually make the angle of the ear so that it's less prominent. Essentially what we're doing is that we're setting the ear back. A lot of times this protruding ear happens because of two reasons. One is what we call underdevelopment of the antihelix. And antihelix is just this portion of the top of the ear where there is a prominence of this contour. And a lot of people with a prominent ear actually don't have that prominence because it's protruding forward. The other reason why people have protruding ear is because what we call the concha, which is actually the lower part of the ear, is overdeveloped. And because of these reasons that the ear is protruding forward. So the surgery encompasses making an incision behind the ear and recreating the antihelix and resecting a little bit of that concha so that the ear sets back correctly. And all of this we do utilizing special sutures to recreate that antihelix and cutting out a little bit of the concha. The surgery itself doesn't take long, about an hour to hour and a half. It doesn't really involve too much pain, and the recovery time is usually about 2 weeks. We ask them to take special precautions about pressure across their ear, and in some patients, we may ask them to wear a special kind of garment that keeps the ear back. It all depends upon how severe the protruding ear was and how much swelling that they actually have.